Hi, my name is Will Rogers. I am 35 years old and I am in Greensboro, North Carolina.
Hi, my name is Rose, Austria. I'm a registered nurse. I'm in Laverne, California.
Rose won a award for nursing excellence at Providence Healthcare Systems. My first question for you, Rose, would be, can you tell me again where you are? I don't think I even know where that is in California.
It is in the Inland Empire. So I'm
Mm.
along the foothills in LA County.
You are a case manager slash care manager. I'm wondering if you would be okay with giving some orientation about what that means for you on like a day-to-day, week-to-week level.
Our team is a team of nurses. We have some coordinators that work with us as well. What we are specifically doing is outreaching to patients to try to help to navigate their care. In my department specifically is more so trying to help in the recovery when an acute episode has happened with different disease processes. Our team works with heart failure patients, COPD patients, and more recently, now COVID patients remotely navigating their care and guiding them through the recovery.
Can you give an example of what that has been like in the past year with a COVID patient?
We essentially in July, after the first huge surge, our team was pulled in to try to help support the continued program. The hospitals essentially through Providence throughout California as well as other states took on the endeavor of trying to support the patient's needs both in the hospital and out. They were trying to figure out how could they in the manner of COVID environment and isolation with the limited capabilities of these patients being able to go out once they get home and access the care that they need. How could we, as health professionals, as doctors, nurses, continue to support these patients that can't now get into offices? What our leadership did is they purchased equipment which consisted of a pulse oximeter and a thermometer. In the hospital or at the urgent cares, they started to instruct the patients how to use those and then offered the telemonitoring. Patients would actually transmit readings to us via their telephone. Those readings would transmit into a program, a software that essentially would send alerts to our nurses.
And are there specific patients who stand out in your memory of what that was like?
One in particular probably stands out the most. A call that was placed because of a lower oxygen rating and a higher heart rate, thinking it's going to be a typical call trying to see if the patient's used all the medications she could. Is she using her oxygen? But coming to find out that as she opened up to explain what was occurring, she had literally just left the bedside of her mother, who had just passed away. So she was then at that point crying, and that was the reasoning why her oxygen level was dropping and her heart rate was going up. It wasn't just meeting the needs of the alert, instructing what they needed to do, but a large amount of support in the loss, in the emotions, in the anxieties, and truly our nurses taking the time to try to help the patients through the different barriers and emotions that they were experiencing in the life and loss.
How was it that her mother had died?
Her mother was dying from COVID. So this patient then had COVID, and she also explained had her husband in the ICU. So she was in a pretty horrible state of loneliness. Her family had gone in to be with her mother at her bedside as she was pretty much taking her last breath. And then this patient had to go in on her own at her mother's bedside. Most of the time, we have family support that we're with when we suffer a loss. We're with other people for those physical hugs, for
Yeah.
just the care that
Yeah.
we need to get through it. And she had to go straight to her isolation,
Yeah.
knowing that her husband is now in the hospital in the ICU and fearing the loss of him, as well as how was she going to do with all of this. I kind of feel like God puts us there where we need to be at
Mm.
points in time. And she was very thankful for the time that was given to her. And I think given the fact that nurses will let each other know I'm involved on a call and everyone else will kind of take over the rest of the load so that we could spend that time that's needed. And I think for her, I may have been the person that needed to be with her at that time.